evening, everybody. Welcome. Thank you for joining Dr. Frgala and myself this evening to talk all things egg donation. I'm going to hand over to Dr. Frgala to introduce himself. If anyone has any questions, please feel free to ask. As always, you can raise your hand and I will voice it, or you can also communicate via the two chat boxes. So we will make sure to answer as many questions as we can. If we don't have time for all, then there will be an opportunity to connect with Unica following this webinar to have any questions answered. If you want to stay anonymous, of course, please feel free. I am Eloise, and I'm the founder and editor of Fertility Help Hub. I have 3 sperm donor conceived children, so I have a big interest in donor conception. My husband is infertile, and we traveled abroad for our treatment. He has Klinefelter syndrome and has 0 sperm. I started Fertility Help Hub 2 years ago to encompass all of the holistic care, expert tips, advice, community that I wish that we had at the time to pass on to others. And I have great pleasure in introducing Dr. Frgala this evening, who is the medical director at Unica Clinic. So welcome.
Hello. Yeah, thanks for this opportunity. Thanks for the invite. My name is, indeed, Frgala, but the first name is much easier actually to go with Thomas or Thomas. And I'm the only Thomas at the clinic, so you can't go wrong with that if you communicate with the coordinator or somebody like that. Today, actually, I'm speaking for both of our clinics. The original one started in Brno approximately 20 years ago, or maybe even longer than that. I believe it's the oldest private assisted reproduction clinic in the Czech Republic with a long tradition. Approximately 6-7 years ago, the sister clinic in Prague started. It's taken off. It's very busy, sort of living life of its own right now, but the operation procedures are the same. We are meeting online with our colleagues in Prague on a regular basis, exchanging experience, new approaches, and checking on our progress. So the treatment is pretty much standard and the same at both clinics. The building seen from outside, that's the clinic in Brno, actually, the original one. And the other 3 pictures are actually from the Prague clinic. The operating procedures, the approaches, the methodology is pretty much the same. The same goes for the equipment and for the expertise that are being developed and tested and then eventually used in practice to continually increase our chances for success, be it with own stimulation of the patient's own ovaries, and using the partner's sperm cell for fertilization of the eggs, or the sperm donation or egg donation program, Unica. It was the first clinic in the Czech Republic that started the egg donation program around 2003, thanks to the fact that the egg donation, or generally gamete donation, is anonymous in the Czech Republic. There are no waiting lists necessary because there is no shortage of donors. So whenever the patients ask, well, how long does it take to set up everything and start the treatment, the standard response is, well, if you are ready as a patient or as a couple, and this is usually discussed during the initial consult, then we can pretty much start with your next menstruation. We have a partnership with well-known doctors across Europe, be it Austria, Poland. The neighboring countries, of course, are the easiest to reach. But it's not just that. We have patients from Denmark, Sweden, from Great Britain, and from the United States. I believe that the motivation for those is, well, the standard of care is pretty much on the same level as anywhere around the world, but the prices are usually a little cheaper than elsewhere in Europe or in the world. So we have many couples from the United States who actually, when they do the math, even with traveling costs and the costs for hotels and everything, it's still less pricey than a cycle in the United States. The holistic fertility program is a very nice touch. It's not something that would be imposed on all patients. dictated to them. It's just a range of opportunities that we can eventually discuss and use if the patients feel like taking advantage of yoga classes online or acupuncture before and or after the transfer, having contact with a psychologist and further possibilities or options like that. The selection process of donors in the Czech Republic is quite similar to the process all over Europe or the world. The regulations, the guidelines that we work with are pretty much the same. Although the Czech Ministry of Health does adjust this to a certain extent, and they actually add some additional tests are mandatory in the Czech Republic. The donors, of course, there's a certain range. According to law, they should be between 18 and 35. This is the same pretty much in UK and elsewhere as well. Having that opportunity and that luxury, we usually pick women between 20 and 30 years of age because that's the age where the quality of the eggs of the oocytes is best. The testing takes a little time. They have to go through sort of a health interview, taking their history, psychological review, blood tests for infectious diseases, for hormonal levels, and the detailed genetic consult, including further blood tests for karyotype, cystic fibrosis, muscular atrophy, and hereditary deafness. Only when the geneticist writes there is no issues in the family of the donor, there are no diagnoses in the donor, in the young lady herself, and there are no mutations, no pathologies in the blood tests performed. Yes, she can donate. Only then she's actually included in the database, and from the database sort of selected, matched for the couple. The selection is based on looks, on physiognomy, on blood type, and on, well, menstrual cycle or the timing of the menstrual cycle. Because if we want to use fresh eggs and fertilize them with, optimally the fresh partner's sperm cells and transfer the fresh embryo eventually 5 days later following the 5-day cultivation, then we need to synchronize both of these women, both the patient and the donor. What's shown here is actually the actual process of that transfer cycle. Of course, there's some preparation involved, and especially on the part of the couple, they have to discuss this, see if it's a viable option for them, if both partners agree, and then optimally a consult. Lately, it's been mainly over Skype or Zoom personal meeting. If we take a look at the course of the stimulation and of the treatment cycle itself, it's tougher on the donor because she goes through the daily subcutaneous injections. She goes through the ultrasound checks and blood tests. The ultrasounds are performed pretty much every 3 days. And then ultimately, she undergoes the oocyte pickup in complete anesthesia. And that's the day where the eggs eventually are evaluated and fertilized with the partner's sperm cells. For the patient, it's much easier. We need to prepare the endometrium, the uterine lining, to be perfectly ready for the nesting of the embryo. And generally, it's pretty much just 2 visits plus 1 ultrasound. The ultrasound usually around day 11, 12, 13 of the cycle, and around 11 days of taking estrogens to build up the endometrium. So the first ultrasound is usually performed back at home, be it Great Britain or elsewhere. Then the first visit to our clinic is on the day of the oocyte pickup. We need the sperm cells from the partner. So it can be the partner himself, and then it's pretty much a 1-hour visit, and he can then eventually leave, fly back home, and then come back in 5 days with his partner during those 5 days of the embryo cultivation. And after those 5 days, the most promising embryo is selected for the transfer. The remaining embryos, there's usually more than 1, 3, 4, 5 embryos, and the remaining ones are cryopreserved, saved for later. And well, the patient is welcome to travel back home. So pretty much 2 visits. 1, the gentleman, sperm disposition. 2, the patient, for the transfer of the embryo.
As I mentioned before, we've had some excellent questions from those who are here tonight. So if we start, Dr. Frgala, I'll start asking you those. If anyone has any questions whilst we're talking, please drop them in the chat box and I'll get to those too. So the first question we had was, when do people typically decide or choose to move on to donor eggs? Obviously, it's a very big decision.
That is true. Well, generally, whenever the ovaries of the patient are not capable of producing healthy, ripe eggs. Maybe the term producing is a bit of a stretch because every woman is born with her eggs, with the whole ovarian reserve. And then the eggs gradually grow older with her and get used up during each ovulation cycle throughout her reproductive age. The quality of the eggs is best between 20 and 30, and it's still good until 35 and acceptable until 40. After 40, it's usually getting more and more difficult. Of course, there are some special situations, such as surgery being for due to a tumor, a benign tumor, endometriosis, genetic diagnoses like Turner syndrome, where the ovaries usually don't develop. The uterus actually keeps the ability to take care of the pregnancy until quite an advanced age. So with egg donation, it is possible to get pregnant at 47, 48. There's only one limit that we need to keep in mind in Czech Republic. Following the 49th birthday of the patient, we are not allowed to treat anymore or to perform a transfer. So when to move on onto a donor eggs, if we dig a little deeper, take a look at it, when the AMH as one parameter of the ovarian reserve and the AFC antral follicle count as the other one are very, very low. We actually cannot really rely on the ovaries to produce any follicles and any ripe eggs during a stimulation. Specialists all over the world, they say, well, no AMH result should serve as a disqualifying factor or disqualifying parameter. So you can always try the stimulation, but then you take into account everything else, the age of the patient, how many cycles there have been performed. And if there are no follicles, no eggs during the stimulation, or there are eggs, but they're abnormal, or it's not possible to fertilize them successfully anymore, or we have actually quite a number of patients who have a successful stimulation and even a favorable embryo development in vitro during those 5 days. But then they have a PGTA, a pre-implantation genetic testing assay, a test for the chromosomal equipment of the embryo. And sometimes at the higher age, over 40, these test results show that all of the embryos, no matter how well they look, that they are aneuploid, meaning of poor chromosomal equipment, poor quality, and not recommended for transfer. So these are all situations that eventually turn the patient to us for the egg donation program.
What about premature menopause as well?
Of course, that's one of the patient groups. That's one of the diagnoses that generally turn to egg donation. And in such a case, the egg donation program represents the strongest alternative. The young egg from the donor, or the eggs from the donor, are fertilized with the partner's sperm cells. And then the patient carries the embryo in her uterus from day 5 of the embryo development. So the connection between the mother and the child is very strong, and the new epigenetic studies are showing more and more how important this in utero phase is for the development of the baby and actually the further generations. So it's a very good alternative. There's only one thing, one note that I always make whilst talking about the premature ovarian insufficiency, when there's no more menstrual cycle, no more activity of the ovaries. One thing is important: don't let the uterus go lazy. When there's no more menstrual cycle, following a long amenorrhea, a long period without menstruation, without activity, the uterus may be becoming smaller, shrinking, becoming hypertrophic. So whenever the menstruation stops, there's no bleeding over 4 months, but there's still actually a plan that the couple or the woman might want to become pregnant eventually. It's a good idea to talk to your gynecologist and ask for a hormonal substitution, sort of to create an artificial cycle which will still keep the uterus active and of the right size.
Egg donation abroad. Obviously, you've touched on people coming from all over the world, including the States as well. And this ties into the process and the timings that you've talked about, especially during COVID at the moment. And we're obviously all very much hoping that travel is going to start resuming over the summer. What does it look like? You said people need to come twice, is that right?
First time for the sperm disposition, the second time 5 days later for the transfer. There are alternatives. Sometimes if it's donated eggs and sperm cells, of course, there's only one visit pretty much, and that's the transfer itself. I've been asked today actually a couple of times, how difficult is that? How much time does it take the transfer? It's a simple procedure taking about 5 minutes, and the whole visit to the clinic doesn't need to take much more than 1 hour actually for the embryo transfer. So that's fairly easy. But yes, usually it's those 2 visits 5 days apart.
One has come through from someone in Canada asking whether it's possible to have treatment with you even with COVID restrictions currently.
Fortunately, the answer is yes, it is possible. We've been gaining experience, and not we as a clinic, but generally as a country or as a humankind. So even though that the so-called second wave, which started or culminated here in the Czech Republic somewhere around, let's say, October, November, it has been possible to travel. It's different country to country. So, for instance, while Austria, they actually issued an official form on their web pages, which we download, we fill it out, we stamp it, scan, and send it back to the patient, to the couple, and with that proof that they are in our care and they need to come for a medical procedure. The patients have been able to come in and travel, be it from Hungary, Austria, Germany, even UK, although it's more difficult for the patients who have to fly, because then you have to dig a little deeper, see what the flying conditions are, and actually what the conditions are for return to your country, because these may differ.
Someone has asked, well, it says on the Unica website, and I think I know the answer to this based on the campaign we've just done together, that you're sadly not able to accept lesbian couples, and they've asked why, and that's due to legislation, isn't it, in the Czech Republic?
Yes, unfortunately, that is true, even though the legislature actually in many points has been quite modern and visionary, taking into account that it's been around for years, or actually dozens of years. There has been an adjustment in 2012.
It's the same for solo parents, isn't it?
It's still true that, for instance, if the woman comes for stimulation of her ovaries and cryopreservation of her eggs, okay, the so-called social freezing, then there are no limits. That's okay. But whenever you want to fertilize an egg with a sperm cell, then indeed the documentation, the consent forms, they need to be signed by a heterosexual couple. But we don't even have the duty to check whether they are really a couple, or whether they live together, or whether they are married.
Moving back to the process which you touched on with the timeline that you took us through, there have been some questions about that, and I think people want to understand what options they have with egg donor selection process, success as well. So someone has said, in your clinical experience, do you see many women successfully becoming pregnant first time, or does it tend to take several attempts with donor conception?
Success rates are the highest. The egg, since it's young, its quality is high. The pregnancy rates, the success rates with the first transfer in the egg donation program, regardless of the age of the patient, because that doesn't play a role anymore with egg donation. The success rates are usually, depending on year, between 55 and 60%. Last year, I believe it was 59% couples became pregnant from the first transfer of the first embryo. There's a good chance that it's going to happen with the first transfer, but there are usually other embryos in the first cycle that are cryopreserved. And if the first one fails to nest, then we can proceed 6 to 8 weeks later with another transfer with another embryo. This procedure being much more simpler and actually much cheaper also. When you actually put these 2, 3, 4 transfers from the same cycle together, the cumulative success rate is well over 70%. Sometimes it gets a little tough. Sometimes there are other problems. Maybe the embryo nests, but is lost eventually during the early pregnancy, miscarriage. But if that happens, we talk about it, discuss it, analyze it, try to eventually examinations that might help us explain that situation. It doesn't always work with the first transfer. It's important not to give up and try again. 97% of the couples, they do become pregnant throughout the 3 cycles, meaning a cycle with a donor and multiple embryos, like 3 embryos perhaps in each cycle. So with these multiple attempts, it's over 97.3%, I believe, the couples do become pregnant.
And then what about selection and matching? You mentioned before that egg donation and sperm donation and I presume embryo donation is anonymous in the Czech Republic. So what happens with the matching selection process, and how much involvement does the couple get?
We are not allowed to reveal the exact or the detailed identity of the donor. We are allowed to share certain characteristics. It's maybe a good idea for the couple when the process is being planned to send a picture of themselves to the coordinator, and we actually have the database with pictures of the donor. We have the picture of the couple. Still, not everybody at the clinic can look into the database since it's anonymous. It's checked from the Ministry of Health, actually, how many people have access to the database. There's a couple of people responsible for that selection process. Whenever they find a match, the following is actually revealed to the couple about the donor or the donor candidate, their age, blood type, their height, weight, eye color, hair color, and their profession or their study orientation, their major.
And what about costs?
There are several packages with combination of methods that are already included. And eventually, it's a good idea to speak with the coordinators who can go into great details. But generally, the stimulation of the own ovaries of the patient costs 2,500 euros. You have to add the medications to it, and that's another 800 or so. The costs may go up if you select special micromanipulation methods or cultivation methods in the lab, such as the time-lapse methods. Okay, so like a closer or observation of the embryos during the cultivation and other things. So that's the stimulation of the own eggs. With the egg donation program, it starts around 4,500–5,000 euro, and then the exclusive program is 6,500, which includes a lot of those methods. But it's 2.5 through 3.5 for the own stimulation, and it's 5 through 6.5 for the egg donation program.
Whilst we're on the sort of selection section of this, so someone has said, we're looking for an Asian egg donor, specifically a donor of Filipino background. Is it possible to find an egg donor with this specific background in the Czech Republic?
In the Czech Republic, this would be very difficult. Asian donors or donors of African origin are very rare. For us to accept the donor, they have to have insurance. You have to actually stay in the Czech Republic for quite some time, so to have that full-scale insurance that would allow for the testing and all the necessary care. And eventually they have to be willing to stimulate. Pretty much 99% of the donors are from the Czech Republic or Slovakia.
Thank you for covering that question. There's also been another question about price. So what I would suggest to the person who's written this is if you want to pop myself an email or be connected to Dr. Frgala or the team after this session, then please do, because they'll be able to send you all the pricing so you can see everything.
Exactly. Any questions about the pricing? It's a very good idea to send them in writing, a coordinator, and they will go into great detail with you, send you the price lists, and eventually discuss it with you.
Moving on, risks. Are there any risks with egg donation?
I believe the risks would be more on the egg donor side, because she's going through the stimulation and through the invasive method of the oocyte pickup. For the patient, the risks are minimal. A frequent question is which kind of medications we'll have to take. Okay, what do we have to, prepare for? It's pretty much just 2 pills, and these are the same hormones that every woman has in every ovulation or menstrual cycle, and that's estrogen, very important for the first half of the cycle and for the building of the endometrium. And then progesterone, which is important for the second half of the cycle, for the so-called secretory phase. We also recommend to take some vitamins and folate. There's always talk about a possible influence on cancer risk. The risks are minimal even in that regard, okay? Ovarian cancer, breast cancer, but generally no effect has been proven. In some specific situations, whenever there's hematological issue, low molecular weight heparin might be applied. If there's some immunological issue, maybe corticoids, prednisone, will be added to the protocol, or infusion of intralipids. If you're not afraid of the pregnancy itself, then you don't really need to worry about the treatment or the transfer cycle.
Someone has said that they have heard that preeclampsia may be more common in women having used egg donors. Do you know anything about this? Have you heard that?
That is true. I have read that as well. There's one thing that we need to realize. Who are the patients that seek the egg donation program? These are usually women over 40, sometimes even over 45. Mm-hmm. And generally in a patient, in a woman over 40, who is a primipara, that means pregnant for the first time, the risk of complications, be it preeclampsia, eclampsia, gestational diabetes, these are automatically much higher. I am not quite sure if this is the fault of the donated eggs or of the procedure. It might be more an issue, of a late pregnancy, especially if it's the first pregnancy of the patient.
What about genetic testing with donor eggs?
In the past 4 or 5 years, there has hardly been a conference or a meeting, PGTA for everyone, ? And this is usually discussed at these round table discussions. Sometimes it's quite an attractive format. One big name, a specialist, is speaking for it. Another one is speaking against it. The latest version that I had a chance to see was about 2 weeks ago, called The Best of ASRM and ESHRE, the biggest human reproduction societies in the United States and Europe. And there was, again, this roundtable discussion. The specialists, Dr. Paulson from United States, from California, the Keck School of Medicine, and Dr. Gianna Rolli from Italy, they agreed on one thing, that it's not indicated in the egg donation cycles. And I have heard the same results, the same data, and the same recommendation about 2 months ago at the February conference. With donor eggs, you don't really need genetic testing because the eggs are young. the risk of mutations or of chromosomal aberrations, of problems generally is very low. So we don't really recommend it. Still, it is available. Once again, there might be exceptions. For instance, there are donated eggs, but sperm cells from the partner. And maybe the partner has a balanced translocation. So in such a case, yes, the genetic testing might be indicated. But as a screening, the answer is no.
We've talked about success rates, but generally, just a quick one, are they higher than in the UK?
Reproductive medicine has great tradition in Great Britain, and some of the top specialists are from Great Britain, and I always look forward to their presentations. The success rates are, I'm sure, at these top clinics are comparable. I think that the advantage might be elsewhere, and that's the anonymity of the egg donor program. That's sufficient number of donors, no shortage of donors. Just whenever it's an open donation program, it's more difficult to invite the donors. So no waiting lists. It might be a much faster procedure. The success rates are comparable.
Can egg donor treatment be successful even if periods are irregular?
Definitely. It can be even successful when there's no period at all. But just like I mentioned about amenorrhea, about the patients who don't have any cycle and the need to keep at least an artificial cycle with a hormonal substitution running. With the irregular period, the answer is definitely yes. These are the patients that are actually indicated for the egg donation program. But what we do in such a case, if the irregularity is like really striking, if it's really problematic, the last period was 3 months ago, and we need to start everything, in such a case, we start with the preparation cycle with like a short substitution cycle, 3.5 weeks, and only then we continue with the transfer cycle. But that way, we not only prepare the reproductive system better for the whole process, but we also individualize the protocol, because during that mock cycle, that test cycle, we are able to take measurements of the endometrium, set the dose of estrogens so that it would perfectly fit this specific patient. So it has advantages as well, but the answer is definitely yes.
Someone has said that they've had bad scarring on their endometrium previously, previous endometriosis, low egg count and blocked tubes. They've had a few procedures to help, but have had 3 failed IVF cycles. Would egg donation be viable for this person with these issues? She's 40 and been trying to conceive for 8 years.
Definitely. That's one of the clear-cut indications. Whenever the endometriosis attacks the ovaries directly, then the ovarian reserve is usually diminished. In this case, for IVF, be it with own eggs or with egg donation, the tubes are irrelevant. They're not important anymore. So yes, when the tubes are not passable anymore, when the ovaries are hurt, after the surgeries for endometriosis are not producing eggs anymore, then definitely egg donation is the answer. The difficult group of patients at 40 with a damaged endometrium, that is a very tough group, because no matter how the embryo was created, was it from own cells, from donated cells, and the endometrium has to be fit for the nesting, for the care. It should have a certain height, it should have a certain quality. If it's been really badly damaged and it turns with the previous curettage or other surgery, myomectomy, something like that, and it's not growing anymore, this can be difficult. But even in these situations, we have a number of protocols with which we try to get the endometrium to grow. And we've had success with many patients where the endometrium didn't react to estrogens at all, but still there are some tricks that we can try, and usually this works well.
Another question before we move on to the psychological side. What tests should be completed by the couple before considering being accepted for treatment?
Well, if they're still trying to decide and thinking whether to stimulate the own ovaries or to turn to egg donation, we might need a little more data. We definitely would appreciate the AMH value, the anti-Müllerian hormone, and ultrasound is necessary. We need to know the whole history. But if the couple has already decided, or if their physicians in Britain or elsewhere back at home have clearly indicated or recommended a cycle with egg donation, it's much simpler. What we should see in every couple are some lab tests, basic lab tests in the patient, in the woman, basically TSH, thyroid gland, thyroid stimulating hormone, TSH, and prolactin, these two. So that's number one, these blood tests. Number two, a spermiogram in the gentleman. We should see one that's not older than, let's say, 6 months, to see that the sperm count and the viability of the sample and the percentage of normally formed sperm cells are all up to par. So that would be the second thing. And it's actually favorable to perform an ultrasound before starting the cycle, to have an ultrasound performed maybe with your gynecologist in the past 1 or 2 cycles prior to the treatment cycle, to avoid any uncomfortable surprises such as ovarian cysts or polyps in the uterine cavity, or myomas actually deforming the uterine cavity.
Please feel free to email myself. We're going to leave contact details here for the team at Unica if you'd like to speak to them directly. I'm sure many of you do have more questions. Now, just thinking about the emotional impact of having a donor-conceived baby and the psychology behind using a donor egg, what are your takes on that from obviously working in the field for a long time? I mean, I can give my thoughts based on being a donor. I have children who are sperm donor conceived, so if anyone has any questions, feel free to ask me about the psychological side of that. But what's your take on it?
I have to admit the luxury that many couples who come to us, who turn to us for the egg donation program, have been discussing it with their physicians in United Kingdom, in Germany, in Austria. They have thought about it, each partner for themselves. They have discussed it amongst themselves. When they already take that step and apply for a consult, then they're usually at least halfway there. So they don't struggle that much with it. They are pretty much, decided, ready to fight, to take that next step. And that's what we do together. But even though I know that I can hardly generalize here, I cannot speak for everybody because it's very much individual. I would dare to say that if the wish to start a family and to take care of the child is really there, and if it's really strong, then this is a wonderful alternative. The mother will carry that baby, that embryo, since day 5 of its development, when it has about 0.2 of a millimeter in diameter, and just starts to grow, starts to develop. And then they do everything together. And during that in utero phase, the development of the fetus, the triggering of gene sequences is influenced by the mother. So the relationship builds up to be so close that I'm very happy to say we have never had problems with the relationship between the mom and the child following the egg donation. Usually, the wish to start a family is much stronger, and quite often they just need a little time to go through that. Just whenever you really love that child and you want to take care of it, then it really doesn't matter where it's coming from or what the origin of the cells is. Just when the love, the effort, the time, it works.
I agree with what you're saying from, as I said, it's sperm donation, my side, but I've lived through my husband's grief of not being genetically related. And there's definitely of course, there's been a shift from diagnosis to what are our options to we want to have a family, however we can do this. So it needs to be a decision that you come to together, I would say. And also, if you need time to come to that decision, take the time to grieve. And I'd also recommend speaking to a counsellor as well. I think that's really key. I don't think that we personally did that enough. But I have to say, there's never once been an issue with my husband bonding with the children, and he obviously didn't carry the children, so we wouldn't wish for any other children. So having lived the experience of donor conception, it's not for everyone at all, but that's why I'm so passionate about talking about it, because if other people can hear from someone who's sort of 4 years into it, I think it can help demystify some of these pangs and concerns of bonding and the psychological side that people may fear before they go down this route.
Thank you. I very, very much appreciate your input, actually. And for me to hear that is very interesting and important. Thank you.
We do still also have embryo adoption on the list as well. Is that something that you offer at Unica?
Yes, we do. The title is not quite official. It's used actually to describe the situation where there were some embryos actually created from donated eggs, fertilized with donated sperm cells. These are not produced, enlarged. That would be considered unethical. But there are some cycles where the couple cannot, maybe the woman reaches that age, 49 years of age, and they donate these embryos. So they're at the cryobank and they're waiting for the frozen embryo transfer. So yes, that is an option. It's much cheaper, of course. It costs about half of the stimulation with the donor. It's a great alternative for couples where donated gametes have to be used from both sides, donated eggs, donated sperm cells, or for couples where the woman is 48 and she's nearing 49, and they don't necessarily want to start a cycle where they will end with 4 embryos cryopreserved, because they won't have a chance to transfer them all.
There's Unica Clinic's direct details if you'd like to get in touch with Dr. Frgala and his wonderful team. Someone has just said, thank you very much for the webinar. This has been so helpful. I hope we've answered everyone else's questions and everyone else has found it helpful, and really appreciate your time. So thank you.